One of the reasons that I came to work at Gloucestershire Hospitals is because I was so impressed with how the trust aligned with my own culture and values in terms of putting the patient at the centre and front of everything that they were trying to achieve, but also being really ambitious in terms of what they were trying to achieve in quite a short space of time.
As an imaging consultant, there was lots of opportunity to develop myself as a cardiologist, but also to develop services.
The best way to describe it is a family unit. The hospital has some phenomenal, talented people working within the unit. People are always receptive to ideas and people are very supportive. For any clinician, those are key elements for any of us to choose where we would like to work. It's quite evident when you meet them that these people are not just here for a day-to-day 9-to-5 job. They're completely dedicated and passionate. It's located in a beautiful part of the country. It's got amazing schools, which is vital if you've got a young family.
We have just got a phenomenal mix of people that have grown up and lived in this county all their lives who want to give back to the communities they're working, but increasingly we're attracting people who may have been considering careers in specialist tertiary teaching centres who actually recognise that this is a trust that's going places and they want to be part of that.
I'm very proud to work for this trust that has such an amazing policy for diversity and support for other minority groups such as LGBTQ and people from BAME backgrounds. Gloucestershire Hospitals offered amazing support to myself and treated me with a lot of empathy and kindness.
We've changed a lot of our management systems. We have a much more agile management process now, with decisions that are made quickly and appropriately, but with necessary diligence and governance. We believe that this is the foundation of excellent care and compassionate care.
We're doing some exciting things around technology, thinking about, we talk about our image-guided intervention hub, and that's again really, really exciting for colleagues joining us in specialties such as cardiology and radiology.
We have many areas of excellence within cardiology in Gloucestershire. I have fantastic colleagues. We have a great intervention service. We have a fantastic device service. We have an imaging department that is growing and is becoming stronger. Working towards better patient care and delivering those things locally is a real admirable aim.
The emergency department and the acute medical unit has undergone a huge amount of change in the last 2 years. We are one of the most developed trusts in the region with regards to our unscheduled care admission pathways.
The recent experience during the COVID pandemic has been a bit of a roller coaster for us as a trust. We were the busiest trust in the southwest in terms of the number of patients admitted into our wards and our intensive care. Some of our experiences have reinforced some of the ideas that we have, and some of that experience has changed some of those ideas too.
Clearly we're in a slightly different era post-COVID, and that has meant that particularly for the surgical division there's a lot of recovery and restoration of service that's needing to go on. However, with that comes huge opportunity to change the way that we do things.
We have worked collegiately, as every service has. We've been able to adapt to the pressures, and with that we've been able to keep up with the acute services. We've also remodelled ourselves acutely and quickly.
It's been difficult and hard at times, and our staff have been fantastic. But lots of positives have come out of it, in particular a real degree of emotional intelligence around understanding the impact of very difficult situations on staff.
We've got some exciting plans. We have 2 different hospitals which give us a great opportunity to develop what we describe as our vision for 2 centres of excellence. We've also got that really exciting ambition to develop ourselves as a university hospital.
The Trust is moving in a really positive direction. We're looking at developing our perioperative service. Our frailty assessment unit is up and running and is very successful. And there is a lot for an enthusiastic consultant to do within that department.
We are a learning organisation. We've got a fantastic quality academy and education track record. Whatever your background, whatever your interests, if you're good and you want to be better,
there would be every opportunity not only for you to develop as a leader, but also really to take a number of services forward.
There's no doubt that the Trust is a busy and challenging place to work, but I feel that the Trust rises to that challenge.
I really encourage anybody out there to come and join our diverse multicultural and LGBT community here in this trust.
Without doubt, Gloucestershire Hospitals is the place that's gripped me. It's full of fantastic people, but most importantly, it has immense ambition.